spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. When not available, use hand sanitizer that should have at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning, standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country about self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they're out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gonna lock down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: Fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing or having direct contact with the infectious secretions of a person with the virus.
Is on.
Good day and welcome to another National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 24th of November, 2021. I am Lesroy Williams. Thank you very much for joining us for our program today. We continue to update you, to bring you information in relation to the COVID-19 pandemic and its management here in the Federation of St. Kitts and Nevis. We are not out of the pandemic. It seems as though it's just not going away. When we think that we are getting over, sometimes you have new cases popping up. You have areas of the world where they're now experiencing other surges and things like that. And so that is why it is important that we continue the fight against this dreadful disease. So thank you again for joining us and for being a part of the management of the pandemic here in St. Kitts and Nevis. Today I would like to invite first to speak to us Dr. Cameron Wilkinson, the Medical Chief of Staff at the Joseph N. France General Hospital.
Thank you, Lesroy, and it's good to have you back. I hope you brought the camel that you promised you would bring back for me. Hope to get it at the end. So the question that is being asked is, will we see a fourth wave as we move to open up our country and the economy? A number of countries in Europe are in the middle of a fourth COVID wave and have had to reintroduce restrictions to try to control the outbreak. They are desperately trying to avoid a repeat overwhelming of their healthcare systems with severe cases of COVID and multiple deaths, as occurred last year when the virus was spreading through Europe. The World Health Organization recently reported on the increasing trend in COVID-19 cases and deaths throughout Europe, with more than 2.1 million new cases and more than 28,000 new deaths reported in the week up to the 17th of November. This marks an increase of 8% in new cases and a 5% increase in deaths compared to the previous weeks, and is the 7th consecutive week of increases they have seen. We here in the Federation have successfully contained our third wave, and our case numbers are now at an all-time low since the wave began. But there is no room for complacency as we enter the Christmas and Carnival season. With the recent removal of the curfew, many went out with the belief that the pandemic was over and that we were back to normal, but this is not so. You heard the Prime Minister last night on Leadership Matters speak to the relaxing of most restrictions for fully vaccinated people once we get to the 80% vaccination threshold for adults as we continue to open our country to the world. This, of course, has to happen as we need to relieve ourselves of the stranglehold that COVID-19 has had on our lives and every fabric of society. We are attempting to relax the restrictions and get back to some sense of normalcy while keeping you safe. The question to be asked is, could the same thing that is happening in Europe happen here as we ease the restrictions? Could we see a fourth wave as is being experienced in Europe? It is not always possible to draw a straight parallel from what's happening in Europe or North America to what will happen here due to differences in vaccination rates, public health measures, population size and population density, and population behavior with the seasonal changes they have there. But we can still learn important lessons to help to chart our course forward. The only how we can avoid a fourth wave is if we are to reclose all of our borders to keep the virus out while the cases we have here recover. But this is neither advisable nor desirable. We need to open up and learn to live safely with COVID-19. And once we are open, despite our best screening efforts, the virus will keep coming. The answer to the question about if we will have a fourth wave is therefore yes. But we are not helpless. We can do a lot to decrease the impact of the fourth wave, even if we cannot avoid it. We have a high vaccination coverage, especially among our adults. We became the first country in the sub-region to reach the World Health Organization minimum threshold of 40% of its population fully vaccinated. But this is not enough to prevent a fourth wave, as we have seen outbreaks even in countries with high vaccination rates. We cannot abandon the non-pharmaceuticals that have been proven to reduce the viral transmission. We need also to continue to vaccinate all who should be vaccinated, as this will give us the best protection against severe disease and death when the fourth wave arrives. We therefore need to get the rate of vaccination up in our 12 to 17-year-olds. We also need to get the rate of vaccination up in our 18 to 40-year-olds, as this is the group of adults with the lowest vaccination coverage and the highest rate of viral transmission. These are the ones who want to play contact sports, frequent bars and on the strips, and also participate in carnival events. Unfortunately, it's the elderly with pre-existing conditions who are dying when the virus is unknowingly brought back home to them while they're in their beds sometimes. We need to take urgent action now if we are to avoid a devastating fourth wave. We cannot have pockets of society unvaccinated despite the overall high vaccination population coverage. Otherwise, the virus will find a home in these groups that remain vulnerable without the benefits of protection from the vaccine. We also have to consider waning immunity in persons who were previously vaccinated. Everyone eligible to get their booster shot should therefore go and get the extra layer of protection that the booster will provide. I'm happy that I got my booster shot today. The Delta variant has accelerated the spread of COVID in Europe and North America. We have not yet experienced the Delta variant, but we need to prepare. If we want to avoid a return of curfews, lockdowns to contain the fourth wave when it arrives and the Delta variant, we need to give ourselves the best protection, and that protection is the vaccine along with the use of the non-pharmaceuticals. Please do not leave yourself vulnerable to the Delta variant when the fourth wave arrives, and so I encourage you to go forward and get vaccinated. I thank you.
Thank you very much, Dr. Wilkinson, for your presentation. I now invite Superintendent Cromwell Henry. Superintendent, of the Royal St. Christopher and Nevis Police Force to update us on the regulations.
Thank you very much, Mr. Williams, and welcome back. Pleasant good afternoon to all listening to this broadcast via whatever means. Last Wednesday, the chairman of the COVID-19 task force announced that when the new iteration of the emergency powers regulation was published, the provision for the nightly curfew will be removed from the regulations. The new regulations came into effect the next day, on November 18th, and will expire on December 2nd. As promised, the provisions requiring residents to remain at their home during certain hours, as well as the provision requiring businesses to close at midnight, were removed. This was the only provision that was removed at this time. All the other provisions, including the COVID-19 protocols for businesses and social activities, remain. We are still required to observe all the non-pharmaceutical COVID-19 prevention measures, the social and physical distancing protocols, the hygiene protocols, and the wearing of face masks when in public. Restrictions on social events are still in place. All social events with more than 24 patrons in attendance require permission in writing from the Commissioner of Police. We continue to grant permission, however, to these activities, but you are expected to adhere to the conditions stipulated in the permission to avoid law enforcement action. We have said all along that there will be a gradual easing of restrictions as our situation improves, and we are doing just that. As we approach an important milestone of 80% of adults with at least one dose of an approved vaccine, you will see further easing of other restrictions when we reach this important milestone. Social events and entertainment generally are being considered favorably in the next iteration of the regulations, provided that we reach, or provided that we achieve the 80% threshold. Promoters and organizers of entertainment and social events will be permitted to host activities where the patrons and staff are all fully vaccinated. These events will be permitted with up to 75% of the venue's normal capacity in attendance. Persons will be required to present their vaccination cards and an ID upon entry, where their contact details will be recorded. We expect that organizers will take responsibility for the safety of their event and only allow qualified persons to enter. The police and compliance team will be empowered to make spot checks at events, and any irregularity will result in the event being brought to an end in the interest of public health and safety, and the organizer and/or offenders fined. Again, we remind you that we are not out of the woods. We are still in a pandemic and therefore have to continue to be vigilant and cautious, and to do all to protect the gains that we have achieved so far. As we go into this new phase, we ask that you continue to act responsibly and get vaccinated, and continue to adhere to all the non-pharmaceutical COVID-19 prevention measures. Avoid crowds, practice good hand sanitization behavior, and wear face masks when you're in public. Thank you.
Thank you, Superintendent Henry. We now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operation Committee Situation Report for today. Dr. Laws.
Thank you, Lesroy. Welcome back, and a warm good afternoon to everyone. All right, so the COVID-19 pandemic continues. When you follow the news, CNN, BBC, you are being told that the number of cases are surging in Europe. Closer home in the Eastern Caribbean, there are a number of our sister islands experiencing COVID-19 outbreaks as we speak. Here in the Federation of St. Kitts and Nevis, we have just contained our third wave of COVID-19 infections. And so over this past week, Wednesday the 17th to Tuesday the 23rd of November, we've only identified 80 newly diagnosed cases of COVID-19. We've had 1 hospital admission during this period, 1 case discharged, 45 recoveries, and we've only added 1 COVID-related death during this past week. Now, this provides a summary of the COVID-19 status. So to date, the Federation reported 2,774 confirmed cases of COVID-19. We continue to enjoy an excellent recovery rate with 2,716 cases being fully recovered. We are only monitoring 30 active cases. I'm so happy, only 30 active cases, 12 being monitored in Nevis, St. Kitts 18. This is the lowest number since June of this year. So we are happy. Our numbers, the number of active cases is reducing, going down, going in the right direction. And we want to keep it like that until at least next year, early next year. Now, in terms of hospitalizations, we only have 1 individual admitted at the Alexandra Hospital in Nevis. And as I said before, we have reported 28 COVID-19 related deaths. Now, when you look at the data, the demographic data pertaining to the COVID-19 deaths, we realized that 24 of these 28 individuals were unvaccinated, 19 were 60 years and over, 7 were within the age group 40 to 59 years. And so I want to pause and reach out to those older adults in our population. So if you are over 50 years in St. Kitts, and if you are still unvaccinated, and if perchance you have been diagnosed with any of the chronic non-communicable diseases like diabetes, hypertension, heart disease, you are vulnerable. And so you are at risk of contracting COVID. You are at risk of even getting severe COVID. So we want to pause and reach out to those older persons. If you are not yet vaccinated, go to your primary care provider, go to the nurse in your community and ask whatever questions you want. Empower yourself with the information about the vaccines. You have 2 options, and make a decision and come on board in terms of accepting the COVID-19 vaccine. In terms of the cases, we've looked at the 2,774 cases, and we note that 70% of these individuals were not vaccinated. 8.1% only partially vaccinated, meaning 1 dose on board, and 22% were fully vaccinated. So again, if you are unvaccinated, you are vulnerable. And even more so now, as we are opening up even more fully in terms of allowing individuals, or soon allowing individuals in, fully vaccinated individuals into the country, maybe without testing. And the tourists, the tourist ships, the cruise ships are here already. And so if you are unvaccinated, you are vulnerable. We launched our COVID-19 vaccination program in February of this year, and it's now 9 months. And so in 9 months, we've done well in terms of achieving these excellent coverage rates. 79.7% of our adults have received the first dose. 73.3% are fully vaccinated. In terms of the children, I think it was September, we started offering the Pfizer-BioNTech vaccine to our children 12 to 17 years, and to date 13.6% of the children within this age band have come and accepted the first dose of the Pfizer-BioNTech vaccine, and 11.3% of the children within this age band are now fully vaccinated. And so we want to reach out to the parents and guardians of our teenagers in our secondary schools. We want to focus on you over the next 2 to 3 weeks before the Christmas break in terms of giving you an opportunity to come in groups, big groups, like, classes, to come into the health center to receive the vaccine. And so we want the parents and guardians to be informed, empowered, and provide consent for your teenager to come on board and accept the vaccine. Now, this shows the data disaggregated. So yes, 79.7% of the adults in our federation have received the first dose, but then you realize it's broken down by island. 84.2% of adults in St. Kitts have received the first dose. 67.9% of the adults in Nevis have received the first dose. And so we want to reach out to the adults and the children, 12 to 17 years, both islands, to come on board. Because again, if you are unvaccinated, you're vulnerable. 52.4% of our total population is fully vaccinated. So we've done well, but we still have work to do in terms of our vaccination drive. Because when you look at, the latest information and the projections for 2022, those territories that are enjoying high vaccination coverage rates, the outlook for such territories is brighter versus those territories with a low vaccination coverage rates. The booster shot. And so the US FDA recently granted approval for individuals in the United States of America to come forward if you're 18 years and over, and if you've received your primary vaccination series, you can come forward and receive your Pfizer shot, your Pfizer booster shot. And so this is the same within the Federation. And so I want to share with you this afternoon that if you received your AstraZeneca Oxford vaccine in February, March, earlier up in this year, and 6 months would have elapsed between the second dose and present, you are eligible. Once you're 18 years and over, you are eligible to come to any of the health centers and request your Pfizer booster shot. So it is available here in the Federation. This afternoon, in the Edu Corner, I wanted to just focus on preventive health care. Now, during 2020 and earlier this year, we have been impacted adversely by the COVID-19 pandemic with a series of strict lockdowns and other restrictions. And so individuals postpone their annual medical checkups and their appointments for cancer screening. So this afternoon, what I want to highlight is the fact that cancer doesn't take a break. So yes, the COVID-19 virus is in circulation and it's impacting us adversely, but cancer doesn't take a break. And so we need to be serious about our cancer screening. So those of us who postponed our annual medical checkup last year, 2020, and even this year, 2021, please, it's Thanksgiving, yes, but I want you to make that appointment to get your medical checkup before the end of this year. If you have not yet done your cancer screening checks for 2021, please make your appointment with your regular physician and have your cancer screening checks done. And so the danger of delayed screening is greatest for persons with known risk factors for cancer. So if you're a female and if you have a strong family history of breast cancer, so for example, if your mom or your sister or your aunt had breast cancer, you have significant risk of developing breast cancer. And so you cannot afford to delay or postpone your annual breast checkup in terms of your mammogram. If you are a male and you have a strong family history of prostate cancer, so if your dad, your brother, your uncle had prostate cancer, you cannot afford to postpone your prostate check, your direct rectal examination, or your PSA test. If you have a strong family history of colon cancer, you cannot afford to postpone your colonoscopy. And so what we are noting in different countries, there is a surge in an increase in the number of individuals showing up with different stages of cancer. And it's as a result of their postponing their annual medical checks and their cancer screening consultations. And so we want you to be aware of this, be cognizant of this, and make sure to schedule your annual medical check before the end of December 2021. So the women, make sure you go and get your breast examination, your mammogram. The males, go and get your direct rectal exam, your PSA tests. Those of you 50 and over, if you have not yet done your colonoscopy, go and have a discussion with your primary care provider. And the females, I want to remind you this afternoon about your cervical cancer screening. So this afternoon, these are just reminders. Let me repeat. If you have postponed your annual medical check and your cancer screening consultations for 2020 and 2021, do not allow this year to end before you go and have those consultations. There is also the non-communicable diseases, diabetes, hypertension. So those of you who are at risk for the NCDs, the non-communicable diseases, diabetes, hypertension, we also want you to go to your physician for your regular annual medical check. So if you are obese, overweight, if you have a family history of diabetes, hypertension, if your lifestyle is sedentary and you're not exercising, and if you are a smoker or you consume excess amount of alcohol, we want you to go and get your annual medical check and be screened for the NCDs, diabetes and hypertension. And of course, the COVID-19 protective measures, come on board, accept the vaccine if you've not already done so. Last night I, reminded the general population about the value of wearing the face mask and maintaining adequate hand hygiene. And if perchance you are not feeling well, you need to stay home. Thank you.
Thank you, CMO Dr. Laws. I recognize among us the Honorable Wendy Phipps, the co-chair of the National Disaster Mitigation Council. I now invite Mr. Abdia Samuel, who is the chair of the National COVID-19 Task Force and the National Disaster Coordinator here at NEMA, to give us his presentation.
Pleasant good evening to all, and Mr. Williams, it's a pleasure to have you back. We hope that you had a very successful trip. And I also want to acknowledge the contribution of the Public Relations Officer in NEMA, Ms. Michelle Rodriguez, who has done an excellent job in the absence of Mr. Williams. So thank you, Michelle, for the work you have done in carrying the mantle forward for Mr. Williams' absence. I also want to take this opportunity today to acknowledge the Honorable Wendy Colleen Phipps, who celebrates her birthday today. So I ask the nation to join me in wishing her happy birthday today, and she has chosen to be here with us today. Thank you again, Minister Phipps, for being here, and also for your dedicated commitment to service to St. Kitts and Nevis and its people. I want to highlight a number of recommendations, bring to your attention a number of recommendations that we have placed before the Cabinet for consideration, and it's important that you, the general public, begin to familiarize yourself with some of these recommendations, as well as prepare mentally for us to move forward in the context of COVID-19. You would have listened to the presentations made by Dr. Wilkinson, Dr. Laws, as well as Superintendent Henry. And it's time for us to move forward. And we have to do so in a very proactive as well as safe manner. So you would have listened to the Prime Minister yesterday in his Leadership Matters program, made reference to the land and go. And what do we mean by the land and go entry process? So the recommendations that are there is for persons who are fully vaccinated and present a negative RT-PCR test within 72 hours of landing in St. Kitts and Nevis to be able to land in the Federation, be processed to the border agencies, including Port Health, Immigration, and Customs, and then they will be able to integrate into society right away, meaning you can take a taxi of your choice and go to your home or a place of residence. You can go into your vehicle, go to your personal vehicle, drive away and go home, or you can have a fully vaccinated member, friend, or family come to the airport and pick you up and take you home. So that is one of the recommendations that I am hopeful will receive favorable approval and consideration in the Cabinet. So once that has happened, we will notify you, the general public, and it will be implemented and updated in our health and entry protocols into St. Kitts and Nevis. We are hopeful that we will have this implemented in a very short time. This also means that the corridor of containment, however, will be maintained for the unvaccinated. So if you have not vaccinated and you're entering the Federation as a resident citizen, meaning that you are a citizen of this country, or you are a resident by being a holder of annual residency, residency by marriage, a work permit, or student visa, then you will have to quarantine for 10 days, 10 or 9 days thereabout. That's part of the recommendation. So the unvaccinated will now quarantine for a period of 9-10 days thereabout. I don't remember the exact number. So that too is a significant move as we attempt to bring a balance between health and economic activities for the country. In terms of the corridor of containment, I want to continue in this vein. We will also see some changes in this area. What do I mean by that? For now, we have residents or persons who are residing in Nevis. They go to the Reggae Beach to take the ferry over to Nevis and then be transported to the place of quarantine. Now, once this measures, the land and go, is accepted and implemented, it therefore means that persons who reside in Nevis and have to travel to Nevis via public transportation on sea can now utilize the ferry terminal services to be able to ferry over to Nevis. So these are some of the changes that you are going to see going forward once our recommendation is adopted and implemented. We have also received a lot of questions about the fencing. And the fencing has brought a lot of controversy and a lot of debate. However, we have taken gradual processes in safeguarding you, the citizens and residents of this country. We started with the physical barrier, and we are now going to move into the vaccine barrier, meaning that the fence at some point is going to come down in the near future, and then we are going to rely on the vaccination barrier to be able to provide us that protection. So yes, citizens and residents of St. Kitts and Nevis, the barrier that was placed, physical barrier of the fencing, was not a permanent measure that was implemented. It was a temporary measure until we reach the necessary threshold to move to the next phase of removing the physical barriers and then being dependent upon the vaccination barrier. What does that mean? There's an 80% threshold that was set. Once we reach that 80% threshold of fully vaccinated, vaccinated persons in St. Kitts and Nevis, then it means that we have to implement some measures to ease the restrictions. So that is where we are at right now. So besides the entry protocols and the tourism-based activities, we also considered and had discussion on the entertainment sector. In this regard, as Superintendent Henry would have stated, the measures that are before the Cabinet for the Cabinet's approval are going to facilitate entertainment activities. So we are hopeful that this can resume. Some of us on the task force, they are humans, and they too are desirous of entertainment. I won't call no name. I have one present, but I won't call no name. So we are all desirous. We are humans. So the entertainment sector has been given great consideration for resumption. I want to highlight something because I have been called by several journalists for the past 2 days regarding some concerns about the functions of the task force and the constitution of the task force, meaning the persons that make up the task force. And I just want to reference number 16 of 2010-20, which is the COVID-19 Prevention and Control Act of 2020. In this act, Section 6 speaks to the persons that make up the task force as well as the roles and function of the task force. And in Schedule 1, it speaks to the task force shall comprise of the following members: the National Disaster Coordinator, who shall be the chairperson, the Chief Medical Officer as the co-chairperson, the Medical Officer of Health and Nevis, Medical Chief of Staff, Senior Representative from the Nevis Disaster Management Department, Senior Representative from the Ministry of Health, Senior Representative from the Ministry of National Security, Senior Representative from the Royal St. Christopher Nevis Police Force, a Senior Representative of the St. Kitts and Nevis Defense Force, Senior Representative of the Immigration Department, Senior Representative of the Customs and Excise Department, Senior Representative of the Ministry of Foreign Affairs, and a Senior Representative from the Department of Information and Technology, a Senior Representative of the St. Kitts and Nevis Port Authority, a Senior Representative of the Nevis Air and Seaport Authority, and it also gives us the powers to be able to co-opt any other agencies and as necessary, whether it be private or public agencies, meaning government agencies. So what are some of the responsibilities of the National COVID-19 Task Force? So it says subject to the provision of the Section 3, the National COVID-19 Task Force is responsible for the coordination of the national response to COVID-19. The composition of the National COVID-19 Task Force is set out in Schedule 1, and the task force may liaise and consult with such other public and private agencies as bodies as may be necessary. 3A, it says the powers of the task force. A, to implement, pursuant to Section 3, national initiatives as it pertains to the prevention, mitigation, and suppression of the spread of COVID-19. B, to inspect the various facilities, including schools, hotels, guest house, places of business, places of quarantine, places of isolation, and other relevant locations or facilities for the purpose of ensuring the conformity with the provision of this Act and any relevant laws pertaining to the prevention, mitigation, and control of the spread of COVID-19. C, to liaise and consult with the relevant public or private agencies as may be necessary. D, to consult programs of public information and education and the mitigation of, preparedness for, and response to and recovery from COVID-19. E, to identify compliance team to assist in its operations. F, to guide the public on the implementations of measures to combat the spread of COVID-19. And Section 4 speaks to the compliance team and what the compliance team may do. So what happens when we have stakeholders engagement? So based on the request being made to the National COVID-19 Task Force, we have institutions, companies, organizations, whether it be private, public, or otherwise, that will request engagement. The task force meets every Tuesday afternoon from 2 p.m. Sometimes we go until 9, 10 o'clock in the night if necessary. And we discuss matters. And these matters that are discussed and they are voted upon based on a collective approach, meaning that what the majority agrees with is what is adopted. Then these recommendations are then submitted to the Mitigation Council chairs, the Honorable Attorney General, as well as the Honorable Wendy Phipps, who will then package this information based on what is submitted to them and make a cabinet submission. Then the National COVID-19 Task Force executive team, executive team will go to cabinet to present on these submissions and give guidance and advice on the submission made. After that is done, cabinet deliberates on the submission and makes the final decision. The final decision is made by the Federal Cabinet of Ministers. Once the Federal Cabinet of Ministers approve any form of recommendation, whether it's altered to fit a particular narrative or accepted as it is, then it comes back to the task force for implementation. Bear this in mind that on the task force, you have persons like the Commissioner of Police, the Commander of the Defense Force, the Chief Medical Officer, who by nature of their own role and responsibilities in that position have powers according to their acts that governs them. So therefore, they too have some powers that they can implement without having to go through the task force mechanism. However, because they are part of the task force, the approach is taken collaboratively. This is important, as an important narrative for us to understand. So it's not that it's a CMO, Abdia Samuel, Dr. Cameron Wilkinson position. The position is taken on the majority. You have about 22 to 25 members that sits every Tuesday under the supervision of the Attorney General and Minister Phipps to discuss and deliberate on these matters before the recommendations are taken to the Federal Cabinet for final approval and then implementation by the COVID-19 Task Force and the relevant agencies. It's very important to note that. I'm understanding that there's some challenge regarding Carnival, just to be straightforward with you. To the journalists who would have asked the questions, Carnival Executive Committee would have been facilitated on several occasions to make the proposal regarding the safe hosting of Carnival. Based on the minutes of the meetings which I reviewed lately, all the recommendations and the proposals set by the Executive Committee of the Cabinet of the Carnival Committee were accepted by the task force. As a matter of fact, the task force didn't have to make much contribution. Based on the minutes, you would have seen how comprehensive the presentation would have been, and as such, there was little or any contribution that we had to make before we just send the recommendations up to the cabinet, where the cabinet would have taken the position as to how the carnival would take place in St. Kitts and Nevis for 2021 into 2022. After cabinet would have approved, a meeting was convened to inform the carnival committee of the decision of the federal cabinet based on the recommendations made. This was then received and well accepted by the carnival committee, who then stated that they will continue, they will go ahead and make the necessary press releases and informed everyone. So there was a collective agreement and understanding by all parties, whether it be sports, carnival, or anybody else, as to how you're going to move forward after the cabinet would have given the necessary approvals to proceed. So it is important for you to understand the process of approval. And the process of approval is consistent with the minutes of each meeting and the recordings of each meetings that we have reviewed for the past few weeks. So I wanted to bring that to the attention of those journalists who have been calling about sports, carnival, and entertainment, and the task force impeding the progress of these sectors. There is no impediment. There is a balance of economic activity and the safety of the country, and based on the cabinet's decisions, we then implement as necessary. So I hope that this could answer some of the questions and concerns that were raised by a number of journalists, and we are open to any further engagement by the journalists so that we can bring clarity to some of the concerns raised, not only by the journalists, because they speak, but also by the citizens, because they speak for the citizens and residents of this country at times. So, Mr. Williams, that is my presentation for today. Again, I'm advising the general public, citizens, residents, of the recommendations that are before the cabinet. Once these have favorable approval, then these are going to be implemented. Like everything else, we have seen that when new implementations come on board, you know, there are concerns. While we are asking, give these recommendations, once they're approved, the opportunity to work, and if they don't work, then we will adjust and make the necessary improvements so that we can have an effective and efficient system going forward. Thank you very much, Mr. Williams.
Thank you, Mr. Samuel, for that description of the functions of the National COVID-19 Task Force and your presentation. We have now come to the question and answer segment, and the first question is, it seems some European countries will begin asking for proof of vaccine booster shots. In St. Kitts, the booster shots are being added to the paper certificate by the Vaccinating Health Center, but as yet have not been added to the electronic certificates at the Ministry of Health. Could some indication be given of when the booster details will be added?
Very good question, Mr. Williams. And so the Ministry of Health is in dialogue with the IT department such that the booster doses will be added to the database and to the electronic vaccination card at the soonest.
Another question. Even if we have 200% vaccination rate, COVID-19 will still be with us. Vaxxed and unvaxxed are working at the hospitals, are traveling on public transport, teaching, etc. Why can't vaxxed as well as unvaxxed be allowed at our carnival?
I think you're correct in saying even if we had 100% of the population vaccinated, we can't have 200%. COVID-19 might still be with us. But what the vaccine does, it protects against severe disease, hospitalization, and death. And so even if we had 100% of the population vaccinated and someone became infected by an incoming passenger, they might be asymptomatic and might not need to go to the hospital. What we don't want to see is the number 28 go to 29 or 30, because we can't choose who we're going to sacrifice to COVID-19. And so we need to make sure that everyone gets the best protection. Yes, there are people who are moving around in institutions, vaxxed and unvaxxed, but in these institutions also, we institute the non-pharmaceutical measures where persons have to be wearing their mask, hand sanitizing, etc. I can tell you, for example, when I go to the hospital, sometimes I get frustrated because I'm going into the hospital with my mask on and I have to sanitize my hand. The first place I go when I go to the hospital is to the lab, and so within 3 seconds I have to sanitize my hand again. But those are the things that keep us safe. When you speak about why can't vax and unvax participate in Carnival, vax and unvax are participating in Carnival. If you're vaccinated and you're going to, if we're having a mass event, we know mass events can be super spreaders, and so to decrease the risk, we allow those events for vaccinated persons. But all these events are being beamed virtually, and so you can participate by staying home and looking at it virtually. If you want to participate in person, then you need to do the responsible thing to protect yourself and to protect those around you by coming forward and getting vaccinated. So I believe in Sugar Mass 50, every single person in the Federation of St. Kitts and Nevis has an opportunity to participate. How much you participate depends on your choice. And so your choice, if you choose not to get vaccinated, you might have to do it virtually.
Thank you, Dr. Wilkins. I just want to share something for 2 minutes. I attended the Expo 2020 in Dubai. That event is the largest event to take place since the COVID-19 pandemic. 192 countries, millions of people. In fact, 4 million people have already visited the Expo in Dubai. In order to attend that Expo, even to get inside, you either had to be vaccinated, or if you were not vaccinated, you must show a negative result from a PCR test. You could not enter into that expo if you were not vaccinated, and if you were not vaccinated, you must show the results of a PCR test done within the last 48 hours. That is how serious they were about this global event. It's a global event, a very large event, where millions of people attended and are attending. And so what is happening, I think, in terms of Carnival here is is nothing that is not happening elsewhere. In fact, Carnival is a small event compared to the expo that they had in Dubai. And that is all because you don't want these big events to be super spreaders, as Dr. Wilkinson has said. This next question, I booked a short staycation through the Marriott Vacation Club program for this week. When I followed up for check-in details, I was told that there is a government policy in place not to accept locals. I checked with 2 other hotels, and they confirmed that they are accepting local guests. Is this policy for Marriott alone?
Thank you, Mr. Williams. And no, the policy is not for Marriott alone. Policies are standard across the board for everyone. So if the hotel has a particular policy, well, we don't know about that. All I know is that a policy has been approved for staycation to occur at these hotels. Thank you.
Thank you, Mr. Samuel. This next question is from Von Radio. Von Radio has been informed that many cruise ship tourists were seen boarding a number of taxis without wearing their masks. They were also seen traveling through Basseterre. Is there a special exemption for tourists, as we have been told to not let our guards down and we should continue practicing all COVID protocols? Should these tourist visitors be expected to follow all COVID-19 protocols? Mr. Samuel.
Right. So, Mr. Williams, thanks for the question. Again, there are health and travel protocols that the cruise lines are aware of, and there are health and travel protocols for the Federation of St. Kitts and Nevis. And part of those protocols is for everyone who enters to our shores or come to our shores and enter our federation to follow these protocols, including the wearing of masks. There is no exemption apart from the age group, the particular age group that is outlined in the health and travel protocols for this country regarding mask wearing. Again, I want to take this opportunity to appeal to the tour operators, taxi operators, and the service providers in the tourism sector to please adhere to the protocols. Please follow the protocols. We have been receiving these reports, Mr. Williams, very often, and I'm hopeful that Superintendent Henry and the compliance team would enforce these protocols. But it has to start with the responsibility of the tour operators. We entrusted that responsibility on them to help with the enforcement of these protocols. We had meetings with these operators. Tourism Authority has conducted training in order for you to operate and receive the travel approved seal. You would have had to go through training, and part of the training is to ensure that you keep your guests and your patrons safe within the context of COVID-19 by adhering to the protocols. So what we will do, and thank you for this question, what we will do again, we will engage the operators, we will engage the major providers and ask them to please ensure that persons within the coming off the cruise ship and otherwise, and even citizens, residents, persons working within these sectors and society wear the mask. Thank you.
Thank you, Mr. Samuel. Compliance, that's the key. This next question, if an unvaccinated teenage child who is a resident of St. Kitts and Nevis travels abroad for vacation as an unaccompanied minor, will the parent who is fully vaccinated be required to go into quarantine at the facility with that child upon return, or can the child quarantine at home?
If the child is unvaccinated, the child will have to be quarantined. And I will tell you as a parent, if I had a child who was coming back unaccompanied and they were unvaccinated and had to be quarantined, I won't have to call into a radio station to find out whether or not I as a parent will go in and quarantine with that child, because that child cannot be quarantined by himself. That child cannot stay in a hotel room by himself, and so whoever is the parent or the guardian will have to go and quarantine with that child, since the child cannot be left alone.
Thank you, Doctor. The attendance at the Calypso tents has been low. Why can't we relax the restrictions to increase the attendance?
I think when Mr. Abdias was giving his presentation, he said that he saw one member of the team who attends carnival events, and I think he wanted to call my name. I have been to many Calypso tents before, and I have not seen hundreds or thousands of persons present at those tents before COVID-19. They are usually kept in little bars and things like that. But for the tents this year, we have 80% of the adult population to choose from for persons to go in to attend your tents. And I don't think that we've had that huge population that you could have chosen from before. And so if you have 80% of the population to choose from, 80% comes to what, 26,000? How many? Yes. And so the COVID-19 restrictions is not what's preventing persons from going to the tent. And so relaxing the restrictions is not going to change anything. And so you can try and ask as many questions as possible, but the rules remain the same. We need to protect the people of the Federation of St. Kitts and Nevis. The safety and security comes first. We'll have other carnivals. There will be a 51st carnival. There was a 52nd. There will even be a 100th celebration. But we need to make sure that people are around next year. And so safety comes first.
You know, a number of us won't be around for the 101. What's the situation on competitive sports now that we are almost at 80%? You did.
One of the things that I said is that we can be at 80% of the overall population threshold, but you can still have pockets of society with a very low immunization rate. For example, the CMO in her presentation spoke about the Federation, where we have actually 85% of adults in the in St. Kitts with at least one shot, whereas it's just 67.8% of persons in Nevis with one shot. And so despite the fact that we could reach 80% by the end of the week, because with the new vaccination figures that came in today, we had 79.8%. You can still have pockets of persons together that have a low vaccination rate, and the virus will find a home in these pockets that remain unvaccinated. And so contact sporting events, those are events that can be super spreaders. And so we ask the persons in the different contact sports to reach a threshold of at least 70% so that they can resume. That's not asking for too much at all, okay? And so despite the fact that we would reach a population threshold of 80%, we're asking the persons who are involved in contact sports to reach a threshold of 70%. And these are the young persons, these are the persons in whom we are seeing the greatest positive cases, but these are the persons who can take the virus home to their mother or their grandmother or to their baby sister who cannot be vaccinated. So we all have a responsibility in this fight.
Dr. Wilkinson, someone is not satisfied with the answer you gave for the child and the quarantine. They're saying that adults are now allowed to quarantine at home, and if the child can quarantine at home with the adult. Yes, yes. Mm-hmm.
Yes, I said somebody has to quarantine with the child.
Right. Given the reduction in the quarantine period for fully vaccinated tourists, can locals who wish to host tourists via Airbnb be eligible to obtain approval for hosting these tourists? And if yes, what is the process?
Okay, Mr. Williams, thanks for the question. My understanding is that these Airbnbs have to be registered through the appropriate authorities on St. Kitts, and once they have been recognized as an Airbnb and they want to provide quarantine services, so to speak, then they will have to apply through the tourism authority for that. However, once we adopt the land and go process, entry process, then it means that persons can go to the Airbnb. So once the land and go process is implemented, approved and implemented, anyone could go to an Airbnb, just like anyone who lands can go to any hotel, can go to any household, to any place of residency. Okay, so that is what I recommend. For now, they would have had to go through the process of, being certified and recognized as, and then applying, making the proposal as to how they can provide these services in the context of COVID. But once we shift into the land and go, then there will be no need for this particular certification from the National COVID-19 Task Force.
Thank you, Mr. Samuel, and that brings us to the end of our question and answer segment for today. I would like to invite someone who always shows up here at these COVID-19 briefings, religiously so, and who continues to show sterling support to what we are doing here at the NEOC. That person is no other than the Honorable Wendy, I think this stands for Colleen, Colleen Phipps. Today is her birthday, and we want to invite her up to show our appreciation for her support and the work that she has been doing here at the NEOC. She is the co-chair of the National Disaster Mitigation Council. Honorable Phipps.
So, Minister Phipps, on behalf of the National COVID-19 Task Force members, by extension the staff at NEMO, and I am certain the Federation of St. Kitts and Nevis, we want to just present you with this little token of appreciation for your commitment and your work, and as well as celebrating Wendy Phipps' Day today. So, Minister, happy birthday again, and we wish you a great birthday, what remains of it.
Okay, thank you so much. Oh, dear. I don't know if I could hold both of these. Okay.
Okay. All right.
Okay. Thank you very much. Okay. I guess I have to say something now.
I guess so. May I help you?
That's all right. Since you helped get me into this. Okay. Good afternoon or good evening, everyone. This is a surprise to me. At one point today, the Attorney General told me I should have taken the day off. If I had taken his advice, I would not have been pleasantly surprised by this. But I just wanted to say thank you to everyone for your good wishes, those that I would have received in this forum and throughout the course of the day. Much appreciated, even though for me, for those persons who know me, birthdays are sometimes very low-key and very private in nature. But I thank you, each and every one of you nonetheless. Thank you.
Okay, that was a very fitting way to end our COVID-19 briefing today. We thank Dr. Cameron Wilkinson. He has been, how must I say it? He has been a voice crying out in the wilderness, really, like John the Baptist. You know? A voice crying out in the wilderness in terms of how people can protect themselves against the COVID-19 virus. And he hasn't always spoken about vaccination, like some people will want to think, but he has spoken comprehensively, not only in terms of vaccination, but also the non-pharmaceutical measures. And he has been there from the beginning. He has sang Calypso. I didn't even know he had a second Calypso, and so on. But Dr. Wilkinson, thank you very much. We thank Superintendent Cromwell Henry for his faithfulness to these briefings. And we know we get a lot of stick and people say all kinds of things on social media. But the cause is much more important. What we are doing here is much more important in helping to protect the Federation than the sticks and stones that we get. Because at the end of the day, we are looking about the interest of the country. And our Chief Medical Officer, Dr. Hazel Laws, for her dedication. I don't think that you can. Her work is so visible for everybody to see. It's like a lamp. It's not put under a bushel, but it is put on a lampstand so that everybody can see the work that she's doing, and she's to be commended. We commend the Honorable Wendy Phipps as well, and that little token that we give to her is really like a drop in the bucket compared to, you know, her dedication and the work that she does. We thank Mrs. Christmas Jacobs, who provides a very important service to a special group of people within our society. I want to thank Ophelia Blanchard, who works very hard behind the scenes, doing a lot of the IT work, the technical work, and PRO at NEMA, Michelle Rodriguez, for her work and for filling in for me while I was away for those 2 weeks. I thank ZIZ and all the media houses who continue to partner with us in this fight against the COVID-19 pandemic. Information is key to keeping people protected. I also want to thank Dr. Marissa Carty. I can't see her, but she works very hard in putting out those reports, those daily reports that we see. She works very hard behind the scenes in doing a lot of other things. And of course, Mr. Nima Lejon James. Thanks to all of you, and thank you for being with us today for our COVID-19 briefing. Until the next time, until next Wednesday, I am Leswar Williams. Take good care.